Hi class, it's Dr. Smiley. I am creating two brief, less than 15-minute audios for you this week since you are learning online and many of you are doing your office visits on Wednesday, our normal class time. Instead, you'll have these brief audios to listen to. So here we go. We're covering patient relations, patient education, and legal issues as well. And this is important because our patients who are more educated, who understand the benefits of comprehensive dental care, will realize the benefits of having current dental images. So talking about patient education in this chapter and of course in this class will be specific to dental radiography, but of course patients who are educated about comprehensive periodontal care are more likely to accept the treatment you're recommending, right? We want a more educated patient base, and that good communication is certainly important in that. You are learning to scale. Terrific. Your hand skills are improving every day, every week, but hand skills aren't enough. Communication skills are essential. Communication is defined as the process by which information is exchanged between two or more persons, and this communication happens in multiple ways. Certainly, we need verbal communication skills, our ability to communicate with our patients in an understandable, direct, and effective way. Of course, there's nonverbal communication skills. We're certainly aware of the importance of eye contact and body language. I like to talk about something called what I consider sort of impact, right, versus intent. Your impact of how you're saying something may not be the intent you had, but it was the impact you gave. An example might be interrupting, someone. Your intent is certainly not to be rude, but the impact of an interruption could be construed as rude. So the difference between impact and intent. And of course, your listening skills, essential. It'd be really fun to talk about this with you face to face, but how we communicate with our patients is so important. If a patient asks a question, perhaps about their coverage, their insurance coverage, don't just say, I don't know. How about, I don't know, but let me find out for you. If someone says, thank you, your response is, you're welcome, or my pleasure, it's not sure, or yep, not a problem. Let's use please, let's use thank you. You certainly don't want to tell an anxious patient to just relax or calm down. That is not relaxing or calming in any way. And you certainly wouldn't want to indicate to your patients that it's a crazy day in the office, even though it might be a crazy day in the office, right? So we wouldn't want to go, wow, it's crazy around here today. You want your patients to think that you've been there all day waiting for them and just them. I've got a little TED Ed in Blackboard. Take the time to listen to that on being a good listener. So these interpersonal skills help make things a little bit easier. They enhance patient trust. So facilitation skills are defined as interpersonal skills used to ease communication, make it easier, facilitate it, and develop a trusting relationship between you and your patient. To do that, certainly encourage questions. Answer those questions directly, honestly, understandably. Maybe we're talking about gum care and not periodontal care, right? We want to use understandable words. Of course, respond with action. I don't know, but I will find out for you. So you turn that I don't know into action. And of course, express warmth. The patient's first impression of the dental office and the dental team really does involve the dental staff. The patient will have had contact through phone. They will have contact through website. They will have contact through the dental assistant. They will have contact potentially through the dental hygienist, maybe even all before they meet the dentist. Your chairside manner, the way you conduct yourself at patient chairside, is what's going to make it relaxing for the patient, right? We want to portray confidence. We want to have an attitude of courtesy, of patience, of honesty. I'm going to talk about patient education. And again, this is patient education as it relates to dental images, to x-rays, because many patients don't understand the importance of x-rays. Maybe they're afraid of radiation. Maybe they just think, oh, the dentist just takes these x-rays to charge me more money. They're concerned about cost. But again, patients who are more educated about comprehensive dental care, their overall oral health, are more likely to realize the benefits of dental images. So you need to know. You need to be able to explain, why are dental images important? How are they going to be used? How do they benefit me? Right? What's in it for me? Patient education enhances understanding. It's going to decrease fear of radiation exposure, definitely increase cooperation from your patient, their motivation, their treatment acceptance. And of course, we can educate our patients in many ways. There are brochures or other printed literature. A number of dental softwares have patient education programs built in. Of course, there's things evidence-based on the internet. You know, think of just some of the brief little videos that you've seen in class talking about the safety of radiation. So I'm going to go through some questions, kind of a question and answer thing that patients might present to you and how they might be answered. So, you know, are these x-rays really necessary? A simple answer, yes. Yes, they are really necessary because so many conditions and diseases can't be detected simply by looking in your mouth, right? I can't look in between your teeth. I can't look underneath the gum line. And certain oral conditions produce no signs or symptoms. How often do I need x-rays? I feel like I just had these. Well, we want to let our patients know that the frequency of dental imaging and dental x-rays is based on their individual needs. Patients who have had a high decay rate, patients with gum disease, patients who have had a recent extensive amount of dental work may need x-rays, do need x-rays more frequently than someone who has never had decay in their life, right, or a very low decay rate. And that's really the same goes for children, right? A child with high cavity rate needs bite wings more frequently than a child who has never had a cavity. Patients will want to know if they can be treated without x-ray images. And the answer is no. That is considered negligent care. So treatment without the necessary images is considered negligence. It is considered below the standard of care. You know, again, explain to your patients, you can't see what's going on in the bone underneath the gum line without dental images. They say, well, they may be new to your practice. Can you use the images from my previous dentist? Yes, you can, as long as they are recent and of diagnostic quality. Okay, so how do you minimize exposure to radiation? And as you now know, there are many ways that we do that, right? And go ahead to explain that to your patient. If you're using film, you're using fast film, F-speed film. If you're using digital, digital radiography decreases radiation exposure 50 to 90%. We take x-rays only when they're necessary. We follow FDA and ADA guidelines. Any number of these things you can say to explain to your patient why or how you minimize their exposure to radiation. Well, if radiation isn't dangerous, why do you put this lead apron on me, right? We want to minimize your exposure to radiation, and we use the lead apron to protect your reproductive, blood-forming, and thyroid tissues. Should a pregnant woman avoid dental X-ray exposure during pregnancy? The Food and Drug Administration and the American Dental Association do not recommend any change in X-ray schedule due to pregnancy. If radiographs are needed to provide comprehensive care or care to that patient, then radiographs should be exposed. There's no detectable amount of radiation to the fetus with the use of a lead apron. Having said that, and again, the FDA and ADA do not recommend any kind of change in radiography based on a woman's pregnant status. Some dental offices do postpone x-rays because of patient concerns. So you will learn that based on your office. But I do want you to know that the FDA and ADA do not recommend not taking x-rays. So if x-rays are safe, why do you leave the room when they're exposed? If they're so safe, why don't you stay in the room? Well, put a smile on your face, and I don't benefit from your x-ray exposure, right, to the patient. So you need to minimize, as an employee, my occupational risk is much higher because I'm taking x-rays all the time, all day long, right? So I've got to minimize my personal exposure, my occupational risk. That's why I leave the room. The textbook has, by the way, these questions and answers to them. The response to in the textbook, are dental x-rays safe? Certainly it's an accurate response, but it's really quite long and not necessarily direct, because it does mention that, yes, all radiation is harmful. Well, that is a fact. All radiation is harmful, but that could make a patient uneasy, a patient that's already uneasy about dental x-rays. So are dental x-rays safe? A direct and honest answer is yes. Then if the patient wants you to get into further discussion, you can discuss the spectrum of ultraviolet radiation, right? We can talk about microwaves and radio waves and your cell phone, and you can talk about dental x-rays and ionizing radiation. But a simple answer is yes, they are safe. And no, they do not cause cancer. Some questions a little bit different maybe about digital imaging. Again, the textbook's a little bit older. Digital imaging is not so new. So the advantages of digital imaging, it requires much less radiation exposure. And what I think of as a great advantage is that the diagnostic quality of these images exceeds film-based imaging, but no specific risks associated with digital imaging. Some patients may wonder, can a panoramic image be exposed instead of a complete series? No. As you've learned, a pan is not a substitute for a complete intraoral series. It is not diagnostic for periodontal disease and caries and should only be done in specific cases, somebody who can't open or has an extreme gag reflex. So those are some of the questions. I'm going to pick up in the next audio. We'll talk about who owns a dental image, and then we'll get into the legal ramifications of dental imaging.